Good afternoon, everyone. My name is Hope McManus, and I am the of Health and Safety for Peninsula, Canada. Very excited to take some time to talk with all of you today about COVID-19 and health and safety in the workplace. So I'm just going to give a couple minutes for some people to hop on before we step right into it. So let's just buffer for about 2 to 3 minutes and we'll be able to jump right in and start talking about some really important information. As we go through this information, please make sure that if you do have any questions, you feel free to type them in the search bar. Hi, Eddie. Thank you. And please feel free to ask any questions that you feel may be relevant. If it is a question I don't have the answer to, please allow me to get back to you. I will make sure that we do get you an answer. One of our moderators do provide you with an answer after the session is complete. So, give it a couple more minutes or so for some of our members and attendees to step in. But yes, it's definitely going to be a really exciting session today. We're looking forward to speaking about, like I said, COVID-19 in the workplace with regards to health and safety. And so for those of you who are just joining right now, my name is Hope McManus. I am the head of health and safety for Peninsula, Canada. Thank you so much for joining today. We are very excited to take the time to speak to you about COVID and health and safety in the workplace. So without further ado, as our audience grows, we're going to go right into COVID-19 and health and safety in your workplace and your small and medium-sized businesses. So before jumping into it, I'll give you a little bit of a background as to who I am and where I came from. So I spent majority of my health and safety professional career working at Air Canada as one of their senior managers for health and safety, and it really allowed me to gather an appreciation for really our frontline workers, how they operate, and what their problems are day to day. And with that background and that education, really gives me the opportunity and to help motivating and working with small, medium-sized businesses. So a little bit about Peninsula. I joined Peninsula over a month ago. I'm very excited to be on board. So Peninsula is a health and safety consulting organization. We're currently in 3 different areas of the world, one being Europe, the other being Australia. And most recently, our Canadian offices opened up in 2017. We started in Toronto, Ontario, and we were able to also grow into Vancouver to better assist our Alberta and BC clients. So very excited about that. To date, we have approximately 80,000 clients worldwide. In Canada, most specifically, our newer operation, we to date have 4,000. So we continue to grow. Our main objective is to really be your guide on the side, your expert, someone that we can provide advice and help you and guide you through these unprecedented times that are associated with COVID-19. As I go through kind of talking about COVID-19 and where we are at today, feel free to ask any questions that may pop up. Hi, Michael. Please feel free to ask any questions that may pop up just in regards to if it's your workplace, general questions that you may have. I know this time is creates a lot of uncertainty for many of us, especially with respects to health and safety. And, our employers are here. We want to make sure that the main objective is to keep our workers safe. So when we're talking about COVID-19, we know it's a highly transmissible disease. So we really need to make sure that we're taking all precautions to keep our workplace as safe as reasonably possible. In a perfect world, we would love to eliminate the hazard, which is COVID. Unfortunately, globally, we're not there yet. So we have to look at other options to take. As a safety professional, when you're talking about dealing with COVID in the workplace, the really important thing to do is make sure that you follow through and do something which is called a risk assessment. So a risk assessment is basically you walking through your workplace and your work procedures and your day-to-day work environment, whether it be through what's currently being done or your possible plans of expansion pre-COVID and look at how you're going to have to amend that with respects to the risk assessment and the controls that you need to put in place. So initially into COVID, part of a risk assessment, Lulu, I see actually you have a really good question, and that's going to build into the hierarchy of controls when I talk about. So when you're talking about hierarchy of controls in COVID, the first step is elimination. Like I said, we can't eliminate it, so we're going to have to go down to the next one. What's the next step after elimination? Okay, well, the next step is going to be substitution. We can't necessarily substitute COVID for another hazard at this point. So then that brings us to the next part, and it's called something called engineering controls, which you may or may not have heard of. Administrative controls, and last but not least, personal protective equipment. So really good question came up, Lulu. What kinds of overall building measures should be taken into consideration? So when you're dealing with a building, it's a really good question. So what you have to keep in mind is common areas first and foremost. So how are you going to handle the common areas? Common areas have high touch points, are likely to have high congestion, and as well, they have visitors coming in and out. So with that being said, you really have to take a look at the current controls that you have in place and revamp it that COVID has been taken into consideration. So public and government guidance has been provided, three of the most important things, which is hand hygiene, it's respiratory hygiene, social distancing as well. So when you're setting up your building, when you're talking about social distancing, you have to make sure that when you are looking at having people back, that it doesn't infringe on the potential of people not being able to maintain a social distance in a safe manner. So social distancing essentially means keeping people 2 meters apart or 6 feet. And that's really to enhance the safety and make sure that the likelihood of transmission with COVID-19 doesn't carry past the 2 meter surroundings. Now, another question and another concern that you have to take into consideration is elevators as well. So elevators are high touch points, and typically we're usually used to having a lot of people packed into an elevator, especially when you're talking about a high story building. That has to be revamped and heavily taken into consideration. So initially, when we may have had 10, 12 people in an elevator, we're going to have to look at, unfortunately, making sure that we can have social distancing, which may mean 2 people. So your next question following that may be, okay, so I'm going to have 2 people coming in at a time. How am I supposed to get my workers into the building by 8 o'clock? Well, that's another measure where you have to take it into consideration and really say, okay, not everyone's going to be able to start at 8 o'clock. So another possibility that you might want to look at is having something called staggering start times when you're looking at building access and control measures. So staggering start times really allows for us to make sure that we avoid congestion in the common areas, so the hallways, the elevators, the stairways, and the reception areas that you walk into. So that's something you want to take into consideration when you're talking about building measures. And in addition, for building measures, what you also want to do is you want to look at the postage that you have in place. It's very, very important that whenever you have occupants of a building, you have contractors and visitors, that you have appropriate postage available so people can follow the measures in place. So appropriate postage, what is that and where do I need to put it? A really good idea is make sure that you have posters coming in, posters throughout the building, and those posters are really going to tell people and educate them on the safe work procedures that you have in place. So you're going to tell people, please respect social distancing. Please ensure you're following proper hand washing procedures. Please ensure that, if you cannot use hand washing procedures, that you follow proper, you use the hand sanitation that's available. In addition to that, respiratory hygiene. Best practice is make sure that you educate them on how to cough into your elbow if, unfortunately, that person does not have a tissue at hand at the time being. So those are some of the measures, in addition to that, what you want to do as well is you want to make sure you consider access and egress, Lulu. So access and egress, try to find a setup in flow in your building. And this is what we're currently doing as well, even in our workplace, where we can avoid people crossing each other where necessary. So essentially, you want to have arrows directing people as another point of signage to say, okay, you know what, anyone who's entering the building is going to stay to the right side. Anyone who's exiting the building is going to stay to the left side. And that will, again, allow you to have the ability to make sure that you're controlling the access and egress and respecting social distancing as much as you possibly can. And in addition to that, a lot of you guys may be leasing a space in a building. So what's important for you guys to do is make sure that you're keeping close with your building operator and you're keeping abreast of what the measures they have in place. So essentially some measures that they may have in place, that's something that you want to communicate to your employees that are coming into work, especially with your contractors and your visitors. Visitors should be limited if it's allowable to do that. And, they should have signage about not entering the workspace if you have displayed any symptoms, in addition to the other rules that you're asking your visitors and contractors to respect while entering that building. Christina, you have a really good question. So do I need to force my employees to wear masks? So I'm sure that you may have seen that there has been Dr. Theresa Tam that has recently put out some communication regarding the usage of masks as an added layer of protection. So masks are something that is called PPE, personal protective equipment. As a safety professional, when you're going through the hierarchy of controls, personal protective equipment is actually the last resort that we want to end up going to when we're trying to control or reduce the hazard to something which we define as low as reasonably possible. In this instance, you have to make sure the first thing you want to do is ask your employees, are you educated on the procedures that are already in place? And that's one thing that you want to cover before when you have that conversation with them. With respects to wearing the masks, like we said, you want to make sure that, you take into account the communication with Theresa Tam. So Theresa Tam is saying it's an added layer of protection, especially when social distancing cannot be respected. But you also have to take into consideration any HR factors or any medical conditions that would prevent them from being able to wear a mask, such as respiratory issues. So that's something you want to stay very close with your HR team on. Typically in the world of safety right now, if an employee does make a complaint about wearing masks, in the event of COVID right now, typically we are seeing as safety does trump at this moment in time. So that's the feedback that we've got back so far regarding the usage and asking employees to wear masks. And I would recommend, as a safety professional right now, and with the communication that Theresa Tam, our doctor, has put out, that you do consider that at this point. But remember, the whole point of masks and what their usage is. The point of masks is to make sure that the particles are the particles are not traveling from anyone that may sneeze or cough while wearing the masks. So it's essentially keeping their fluids in instead of preventing other fluids from coming out. And also, if you are asking your employees to wear masks, please make sure that they're educated on the proper procedures when donning and removing a mask. I see this many times where people are wearing masks and they essentially take the mask down to talk. That's actually creating more of a hazard than anything to your workers or anyone wearing a mask, because you're actually creating the touch points and you're increasing the amount of time that you're touching your face, which in turn increases the likelihood of transmitting COVID-19 if you have touched a surface that has become infected with COVID-19. So a really important thing to do is make sure that if your employees are wearing masks, they reduce the touch points. And in addition to that, if they are having to take off their masks, then make sure that they are properly washing their hands and using hand hygiene when doing this. If there is no hand washing stations available, please ensure that you have hand sanitizer available for your employees to make sure that they're able to still disinfect their hands to that point. So that's a really good question. Christina, thanks so much for asking that. And these are things that, you'll find, and I'm sure that we all see this as we tend to go throughout this pandemic and learn new things every day. You'll see in the beginning where masks were heavily discouraged, whereas up until a couple of weeks ago, there was a conversation by the government and public health officials that non-surgical masks may actually be beneficial with regards to the current COVID-19 pandemic. Like I said, masks, gloves, They are typically the last line of defense. So it really should be a last resort when you are talking about wearing masks and PPE. Sometimes when we are talking about gloves can create a false sense of security because you're not typically as apt to wash your hands on an as frequent basis as you normally would. And that's, unless you are dealing with an infected person or you are a healthcare worker. I do see a question coming from Gemma. So Gemma, great question. If there is a positive case in our workplace, what should I do? So in the unfortunate event that we do have, or you do have a positive COVID-19 case in your workplace, you want to make sure that first of all, you have the proper procedure in place. So when you are developing your return to work plan that will assist you with, building measures, communication measures, hygiene checklists, you also want to create a plan that talks about dealing with a positive case in the workplace. That positive case in the workplace should outline the steps, and your employees should be briefed on the steps. So the steps should essentially look something like this. First of all, an employee approaches you and says they are positive, COVID-19 positive. Immediately what you need to do is you need to tell the employee to please go home. We want to reduce the likelihood of that transmitting in the workplace. And it's very important that everyone has this documented as well. Employees have a clear understanding. So what you need to do, like I said, first of all, is make sure that you send them home right away. In addition to that, what you want to do is you want to see where the employee has been in the workplace in the past since they have had the onset of symptoms. And what you want to do is you want to properly disinfect the areas that employee was, and consider different things like door handles that they may have touched when they walked in, elevator buttons that they may have pressed, any computer equipment, any electronic equipment, any pay equipment that they may have touched, any tables, any chairs. Those things should be properly cleaned and disinfected immediately upon receipt of knowing that that person does have COVID-19 in the workplace. And what you also need to do is make sure that that employee does contact public health right away. And public health will do something that's essentially called, and I'm sure that we all know this right now, contact tracing. And contact tracing essentially allows public health to go back and speak with the employee who is infected and get the names and the names of the people that may be considered at risk, and they will personally contact these individuals and make sure that they either A, monitor their symptoms, or B, that they self-isolate for the 14 days from the onset of symptoms that the individual did start presenting their symptoms at. And then what you want to do is just make sure, it's very sticky. We want to make sure that we don't necessarily share the name of that person that did have COVID-19. But what we should really do is do make it known that yes, there is a case. Here are the procedures that we've taken. Here are the procedures. This is what we have done to ensure your safety. It's always good to have very clear communication with your staff when this does happen. And it's good for them as well to make sure that they can self-monitor for the 14 days, even if they aren't considered at risk and they weren't in close contact with this employee. So a good question from Nikki is, what should the employer do when employees refuse to return to work? The reason for the refusal is that they're afraid of catching the virus while commuting to work. It's a great question, Nikki. So what's going on right now is, I'm sure that you have seen this, but there has been a spike in work refusals because of COVID-19. So much that Ontario alone has a COVID advisory committee that deals with these complaints coming through. It's important to know that the government is there absolutely to protect the workers. And it's our job as employers to make sure that we provide them with a safe workplace. So the caveat to that is that a lot of the work refusals that have been happening have been denied. The only ones that have been upheld, and when I say upheld, I'm saying that yes, the inspector that has come in and work refused, once you've gone through the steps, the employees, essentially the ones that have been upheld are the ones that the inspectors have seen that there hasn't been social distancing in place. So really, before an employee is telling you that they want to refuse, it's an opportunity, Nikki, to really go back with the employee and say, let me take some time to educate you on the proper control measures that we have in place. So not only that, but with regards to the commute, this is where you might want to take into account looking at staggered start times to avoid um, them having to take public transportation in a congested time. I know there are different modes of public transportation that are implementing measures that will adhere and respect to social distancing. There are many public transportations that are asking a lot of their passengers to wear masks as well. So those are certain measures that you want to take in place, and just speak with your employee about it, and you know see how to from an educational aspect how we can kind of ease their concerns. So just to recap on that, make sure that you can see, can this employee start at a different time that we can avoid congestion? In addition to that, do they have alternate modes of transportation available, which they ultimately don't sometimes. So that's why you really want to work if you can, stagger their time. And that make sure that they're educated on the proper measures that are in place. And then with regards to their public transportation that they are taking, there should be measures in place by that public transit company to promote social distancing, hand hygiene, and whether the case or not that they are denying people that are sick, or they have postage up in the area to make sure that they're denying people that are unwell. A good question from Supira. Sorry if I said that incorrectly. So if we have a staff member that contracts COVID-19, do we have to share the name of that individual? So it's a good question. I covered. I'll just recover that again. So in the cases, when there is a positive case in the workplace, we really recommend, please don't share the name of the individual that does contract COVID-19, but you should be letting your staff know that yes, there was a case of COVID-19 in the workplace. You should be letting your staff know about that. And the reason is that they should be, they have a right to know, and that's under our employee law. In addition to that, they should be able to self-monitor. A good idea for business owners to do is to make sure that they have a questionnaire available for their employees, as well as their clients and customers coming in. And it's a really best demonstrated practice right now to make sure that we have our staff and your staff fill that out prior to coming into a shift. And that will really allow for you as an employer to make sure that if there is something that does, an employee that does have symptoms, you can take action right away, rather than have to, deal with a case after the fact. So it's a really good question. As we go through this COVID pandemic, it's definitely been very reactive with regards to the safety aspect and how we've been handling it. We are working with governing authorities, public health, and making sure that we're staying very close to their guidelines. World Health Organization, as well as CDC, are key communicators. And when we do have changes to procedures that we have to put in place, that we have to stay very close to. British Columbia remains to be very, very stringent upon, the measures. They are in phase 2 right now, which is fantastic. However, any workplace that can open in British Columbia really does have to make sure that the enhanced protocols are in place. In addition to that, they will be subject to an inspection as well. So British Columbia remains to be moving forward, which is, fantastic for them. They monitor it very closely. Alberta remains to be in phase 1 right now. So, they're still taking the conservative approach, which means that, a lot of non-essential businesses remain to be closed. When we're talking about Ontario businesses, I'm sure that you all have seen right now, the Emergency Act was extended for another 28 days, which means essentially, we have no non-essential businesses opening at this point, unless you can follow the enhanced protocols that they have provided, which does reiterate, having a store opening entrance, which is one of the options that they would have to abide by. So the emergency order, as long as it is in act, really, does mean that the restrictions are not going to be laid at this point, relaxed at this point in time, which means it's a really good opportunity for you guys to take a look at your businesses and say, when this does happen, and let's say that, once the Emergency Act has been lifted following the 28 days, if we are have an ability to move into phase 2, in Ontario following the 28 days, then, how do we do that and how can we get the doors open? I've seen a lot of businesses now wait until they have been given the green light, and essentially, you don't want to wait until you have the green light. You want to start making the plans now. So start making the plans on, how are you going to communicate to your staff? How are you going to take a look at your current procedures and how are you going to revamp them? A lot of people don't consider, their first aid kit. When you have a first aid kit in the workplace and someone does have to use it, you can really be assured that social distancing will be infringed upon. So it's also looking at your first aid supplies as well and seeing how you can accommodate that. And that may be, adding something such as a face shield to your first aid kit to help protect your workers even more. Another question that came in, we use work vehicles. If many people are using them, what should we do? It's a great question. So yes, we have a lot of clients coming through right now where they have work vehicles, and social distancing does not go away when we are dealing with work vehicles. Hand hygiene does not go away, as well as disinfecting procedures. So best demonstrated practice right now is to have one person per vehicle at this point in time. If you can't do that, you need to make sure that you can absolutely maintain that 2-meter distance in the car. And that may mean someone not sitting up front. If it's possible, it may mean someone sitting in the back. In addition to that, having a work vehicle, you can also look at putting engineering controls in place. So engineering controls are something that is an added protective barrier to essentially stop the transmission of COVID-19 spreading. So it's important that if you are considering engineering controls to install in your work vehicles, that they have to make sure that they're not infringing upon the Occupational Health and Safety Act, and they do provide clear visibility. They're the appropriate material that can be regularly cleaned and disinfected, and it doesn't, it should be able, the worker should be able to still conduct their job with ease. There shouldn't be any blind spots that have been produced, and etc. If possible as well, you should consider the use of masks, whereas in cases, like I said, social distancing cannot be respected. And you should also make sure that there's a very rigorous cleaning schedule that has been implemented as well. So if you have different workers going into vehicles, you have to make sure that you keep a log of who's in that vehicle. It's very important to do that. And the reason for that being is, you could have a worker who unfortunately contracts COVID-19. And that's where you can save yourself a lot of legwork and say, okay, well, I know that this worker worked in vehicle A or B and they went here. So that will allow you to do more of a better investigation with, finding out in what areas and how to communicate to who, if COVID-19 does happen in your workforce. So like I said, have a very vigorous cleaning schedule, consider engineering controls, consider PPE as a last resort, and please try to maintain the 2-meter social distancing rule that is in place. Those are key things that you want to look at when you are dealing with, work vehicles. It's very difficult, but, consider the handle that they're getting in, the steering wheel, the front, the dashboard that they're dealing with. If you provide them with GPS, those need to be wiped down as well. And, there's a difference of wiping down and disinfection. So you also have to look at your products that you are using for cleaning, or just make sure that if you do have a third-party cleaning provider, that you have a clear understanding to make sure that that product that they're using is adequate and will properly disinfect the surface to reduce the likelihood of anyone else contracting COVID-19. So a great question from Cassidy. I'd like to start taking temperatures as a precaution for my staff. Can I do this and can they refuse? It's a great question. It's a question that's very much married health and safety and HR as well. So if you are planning on taking temperatures for your staff, what you need to make sure that you have is a consent to do that. And that could simply, Cassidy, have them filling out a consent form, which, the reality is that, as HR and a health and safety company, we are not seeing many employees refuse to get their temperature taken. So just make sure that you have them complete a consent form that they will have their temperature taken, and you shouldn't have any issues with that. If you do, like I was talking about the mask question that came up earlier, typically safety is trumping lately. The only thing that you may need to be careful about, and I can link you in with one of our HR advisors following this stream, is that if you are taking temperatures, you have to be careful because the temperature is, could be classified as medical information. And typically employers are not privy to medical information. So that's one thing that you want to consider as well. Well, we can, there are some products that are coming online that we are seeing that's basically not sharing the temperature with the employer, is just giving them a green light, yes, or a red light, no. That's something that you want to take into consideration. But yes, you absolutely do have to get that consent. Another note, when you are talking about having your temperature taken, it's very important to consider, don't let that be your sole assessment when you are welcoming and having employees come in for shifts. And the reason being is that, we have all seen this pop up, that sometimes COVID-19 has not all or none or no symptoms. And that's the unfortunate part of this. So, Cassidy, you could take someone's temperature and it could come back okay, but they could unfortunately still have COVID-19 and they could be presenting other symptoms as well, which is why it's a really good idea to make sure that you have them take a moment, fill out a questionnaire. Peninsula does have a questionnaire readily available for, our clients to have them fill out before every single shift, as well as we have an electronic version right now. And if you are looking for another one, there's also, if you look at British Columbia, they have an online assessment tool. Ontario has an online assessment tool, as well as Alberta. So all of the provinces, including Quebec, they all have assessment tools that you can ask your employees to, regularly undergo to make sure that they are okay to come to work. But those are just some considerations that you want to take into place when you are looking at instilling temperature checks. Just with regards to sharing that information, knowing the medical information, because it could be seen as medical, making sure that you get the consent, which is key to making sure that you get consent, and just knowing that there are other options as well, such as making sure that they're going through that questionnaire you are providing them and you're asking them to take, which talks about, have you had coughs? Have you had trouble breathing, fatigue, weakness? Those are key symptoms that we want to make sure that people look out for. And these are things that we want to make sure that we post in the workplaces as well. And as you welcome workers back to work, these are signs that you want to train them to be aware of and to get ahead of. So it will, we are anticipating that, COVID-19 unfortunately will be with us for, quite a while until a vaccination is found. So the reality is that, employers are going to be bound to make sure that they keep these guidelines in place until further notice. And, if you ask me as a safety professional, I don't believe that these will be going away anytime soon. So, it really forces companies, companies have been through something traumatic right now, and as well as their employees. And it's really forcing them to think about, different ways to operate, if it's even possible, and how to make sure that, we're consistently not infringing on social distancing, and we're not infringing on, making sure that, we make sure that we're training people properly and telling them to wash their hands and having hand sanitizer stations available. It's not something that was completely at the forefront prior, but, is definitely all over. It's the first thing that people look for when they're walking into, their workspaces now. So Lulu, what should I do if a worker shows up with symptoms? It's a good question. And it is likely to, happen to quite a few of you, all of you at some point, as long as the pandemic is happening. What I do recommend is making sure that, that employee does not work today. It's to keep, you have to keep the safety of your workers. You have to follow suit. You want to be leaders. And being a leader in your industry is being, health and safety excellence and HR excellence, right? So don't take the chance. I would absolutely send that employee home, but I would also ask them as well, if you haven't, make sure that they're filling out that questionnaire, because that's what we should also be doing. And please ask them to contact public health as well. Public health is, currently accommodating and planning to, widen their ability to be able to do more assessments, as we have seen in Ontario, which has been great. So we need to really push that. We need to say, we want you to get checked. And it's really for the safety of themselves, it's for the safety of their family, and it's for the safety of your workplace as well. So Tanya, in the event that you believe a client in your facility may be ill or displaying symptoms of COVID, what are the appropriate next steps? Great question, Tanya. So first thing we want to do, like I said, Tanya, is have them fill the questionnaire. If they have filled out the questionnaire and they are displaying symptoms, what you can do is so there's two folds here. If they haven't been in the workplace yet, which is great, and they haven't touched anything, please ask them to reschedule. That's, like I said, safety trumps here. We're in the time where we have to take this seriously. We can't, it's important that we keep our employees safe. So what we can do is, please, ask that client, customer, patient to reschedule and come back another day, just of the safety, for the safety of your staff and the safety of your operation. The other part, the other twofold part of this is that if you have someone that has already been in your office, in your waiting room, in your facility, what you have to do is then put into place, your cleaning policy, safe work procedure that you've put in place. So what you need to do is, please ask them to leave, nicely, or we can ask them to reschedule. And you want to take a look and say, okay, where has this person been? If they've been in a waiting room, what chair have they sat in? Have they touched a magazine? When they walked in, did they touch the reception desk? So we want to make sure that the proper disinfection procedures are put in place, just to be on err on the side of caution. Wipe down everything, clean down everything that they have touched. If they've touched a door handle to go to the washroom, those are the things that you want to consider, just to make sure that you're covering all of your bases. If that person does come back and is COVID-19 positive, it is very likely that the public health agency will contact anyone who they deem is at risk. And at risk means, per World Health Organization and CDC, anyone that has been in a close proximity within a prolonged amount of time. When we say prolonged amount of time, you're going to say, Hope, what does prolonged amount of time mean? Essentially, that means anything that is 3 minutes or longer. So if any of your employees that have been around that person for 3 minutes or longer, that could essentially prompt a call from public health. And public health will actually reach out, like I said, to any of those individuals who they believe would be at risk. Following the conversation with public health will give guidance to those people that they are contacting, and they will say, first of all, they're not going to say the name of the person. They are going to say it may be a case, and they are going to say either, I want you to self-monitor for 14 days, or public health will ask that particular person they are contacting as a result to please self-isolate for 14 days. What if one of our, question from Shanila, I'm sorry if I mispronounced that. What if one of our employee goes into an isolation as that employee was in close contact with someone who tested positive? So essentially, if I understand correctly, so if one of your employee goes into, so basically your employee may be of a contact of a positive case in the workforce. So there's different regulations per province. So BC BC and Alberta are legally requiring people mandatory self-isolate for 14 days that have been in close contact with someone who has tested positive. Ontario, we're still waiting on the definitive answer for that. But you will have to make sure that, we do provide that employee with, that employee is essentially going to have to follow public health guidance. So we cannot infringe on their ability to be able to follow that. So if in the event, they do have to, self-isolate, make sure that we do accommodate that. So, and if you are questioning, how do we know for sure this person was really asked to self-isolate, there is an ability to, upon how you want to decide to run this as, with your organization, is you can ask for, a medical certificate from their general practitioner or from public health if they are providing one. Just asking them to please make sure that they do self-isolate for 14 days. And it's important that when you are getting that medical certificate, that you have the end date on it. Further to that, if you are having a person coming back into the workforce following the 14-day isolation, it would be my recommendation that you make sure that there is a medical clearance that you do obtain prior to that person coming back into the workplace. And that really ensures the safety of yourself and your organization. And that medical information that you will receive both ways, you just need to remember that all that medical form may say is that person is clear to come back to work or not clear to come back to work. And that really goes into what we're talking about, someone's medical information. So the doctors will 99% of the time, they will not share their medical diagnosis on that note. And just note that you don't necessarily need that. What you do need is you need to know how and when to accommodate the employee per the medical practitioner's note that you receive. So another follow-up question to that is, do we ask other employees to go for testing who are in contact with the employee? So if I'm understanding, what I would say is that if there isn't a person that is a contact of a contact, and that person was around other workers, typically what has been doing is people are really self-monitoring right now, but I would tell them to make use of the self-assessment tool and to call public health as a precaution. Ultimately, there's not, because there's not a positive, if they were in contact with a positive case, like I said, public health would be in contact with them directly and be, keeping them abreast of the next steps in place. And that's how we would take that's how we would follow up on that. However, really what you want to do is make sure that, if those employees are showing any symptoms, advise them to contact public health. Public health will say yes or no, and then they will give them the next steps on, what most appropriately to do in that situation. So I hope that answers your question. And if there's more information on that, you can always reach out to our advisory team as well. We do expect Ontario, Alberta, BC regulations to continuously evolve and change. And this is something that we really have to we have to stay abreast of. And this is something that we continuously do. And as employers, the situation does change daily. I'm sure that as you have seen, the extension of the Emergency Act, that happened quite rapidly. We know that BC was a little bit more straightforward with their reopening of the province plan, where they had specific days where they were entering phase 1, phase 2, and phase 3, and Alberta as well. So, the provinces, the local authorities, we are all dealing consistently with a changing situation. We are, and you guys in the businesses are, definitely working very hard to adapt the newest of the changes in place. And it can be hard to keep on top of them, right? Whereas, like I said, we have ever-changing information about masks, information about gloves that had first come out when we were talking about the initial COVID-19 pandemic, and whether to use gloves and whether to not use gloves, and if they promote a false sense of security, unless you are working in a healthcare facility or you're working with an ill or infected patient. So those are important things to consider. It's something that Peninsula stays very close to, just to make sure that we are providing you with the right documentation. We have our UK operations as well that has been dealing with the same information that has been coming through in the government guidance that continuously evolves. It does really, of course, require, like I said, quickly adapting and patience. But, as we're all in this together, we'll make sure that we get through this. Good question from Christina. What kinds of communications need to be relayed to customers and clients? I love this question. So when you're talking about customers and clients, I'm sure that you've seen from, if you're subscribed or you are signed up with any of the businesses, you're seeing emails from those businesses that are starting to go out to clients. So that's something that you want to make sure that you're doing with your business when you are looking at reopening. So when you're talking with your clients and customers, after you've created your safe, return to work plan, and you've communicated to your employees, you also want to make sure that you're letting your clients know what you're doing and, the procedures that you have in place. Because most definitely when your clients are going to return to the workplace, or your office or your restaurant or your salon, things are going to look a little different for them. And it really helps when you take the time to either send an email, give them a call, update on your website, update on your social media, whether it's Facebook or Instagram, and let them know the changes that you have put into consideration, because at least the customers know exactly what they're walking into. And some examples of what you may say, we'll talk about social distancing. Hey guys, we haven't seen you in a while. We notice, you may notice some changes. There could be a difference in how to sign up for appointments to reduce times in the waiting rooms. So your waiting room could be closed down. Your offices could be by appointment only, which reduces, which enhances social distancing and, reduces the risk of the transmission, which is fantastic. So it could be talking about your appointment times, staggered wait times, waiting room that is closed. When you are in the building, please make sure that you adhere to social distancing. You're asking them to follow the arrows that you have laid out. Please pay attention to the signs. You will have to ask your customers and clients to please make sure that they do not enter the facility if they have any of the following symptoms or have been in close contact with anyone who has been a positive case. So that's something that you can either have them fill out a questionnaire, or you can post it, or you can send them an email at the time of booking to make sure that they fill that out so they're a go to come in. So you want to make sure that you communicate that to your clients as well. And if you do choose to have your customers wear a mask, you can also take the time throughout your communication, like I said, whether it's email, social media, giving them a phone call to say, we do recommend that you do wear masks at this point in time before entering our facility. So that would be key to mention as well. And in addition to that, when your clients get there, please make sure that you have posters, because that also serves as a great means of communication. So, there's a lot of stuff for them to remember. Everyone's dealing with the mental stress about, going through a new norm of way of life. So some things could be forgotten, right? Some things could, slip through where someone may forget to actually cough into their elbow. But having that reinforcement signage, posters, posters, anything on your televisions. This is times where we need to get creative to make sure that they absolutely get the message. And what could that be? What that could be too is also, with the available media marketing that you have or apps that you have, even a push notification to your clients to say, hi, can't wait to see you today. Please make sure that you consider the following. You will not be able to enter a facility unless you have a mask. And again, about the mask part, you can choose to instill it. You can choose not to instill it. Like I said, it's meant for places where social distancing may be infringed upon. You're at a grocery store, someone may forget they're supposed to be social distancing and come up right behind you. So those are definitely ways that you want to make sure that you keep having communication. Those are ways that you want to communicate to the clients. So those are really good things to consider. And like I said, Christina, the information will always change. So keep abreast, keep familiar with any changes that may happen with regards to, the guidance that has been provided by Ontario, BC, and Alberta, because there may be a time that Alberta turns around and says, okay, actually now we are going to absolutely make sure that people are wearing gloves. Not likely, but in the event that does happen, we do want to make sure that you can adapt your guidance documents for your clients and your staff to make sure that, it is aligned with the public guidance that is set out by the governing authorities. Because keep in mind as well, there has been an increase of inspectors hired from WorkSafe BC, from the Ministry of Labor, and from Alberta as well, to make sure that employers are properly setting up their workplace to ensure that we are following and employers are following those guidelines as set out. And in addition to that, they are really interviewing employees to make sure that employees truly feel comfortable. And that's really where, like I mentioned earlier, it's very important to make sure that you have consistent communication, keep an open door with your employees, make sure that they're aware of the changes. You guys may have employees that are working, they may be working one shift on Wednesday and then a shift in a couple weeks. So for you, it may be, second nature of the changes, but for your employee who hasn't been there in a couple weeks, it's prudent that they're aware of the changes in place. So please make sure that you always keep the lines of communication open. with your employees, because we want to make sure that we do support them. We want to make sure that they're, aware and they feel comfortable. And by doing that, we can really allow to have, less work refusals and, to have the trust of your employees. And trust with COVID right now is the most, if not one of the most important things. So a question from Cassie White: what penalties would occur if we are visited by the MOL and are deemed unsafe, even though we feel like we've done everything in our power to prepare? So when you're talking about the Ministry of Labor coming in, with respects to COVID specifically. So in normal circumstances, the Ministry of Labor investigates everything with regards to health and safety meetings, postings, everything that's applicable, but especially with regards to the COVID-19 pandemic, what they are going to be looking at specifically is that you have the proper controls in place in alignment with the governing body, which is social distancing, hand washing, making sure that there's training, easily displayed information. If the MOL comes in and sees that this has not been followed, what they can do is they can do something which is called a work stoppage. So it's very important to understand here that when MOL comes into your workplace, you absolutely have to abide by what they're saying. So if they are shutting down your workplace, you need to shut down your workplace. That's a very, it's a very, very tough thing to hear. It's not something that any company wants to do, but they are essentially shutting down your workplace because they may feel that you do not have the proper procedures in place to make sure that, you're keeping your clients and your staff safe. So you could face a work stoppage, which would essentially close your business until you and the MOL have a conversation about the appropriate measures that you actually have to put in place prior to reopening. You could face a penalty. And that could cost, we've seen penalties cost, upwards to, in the rare case, but up to, $1 million if there are, deaths or severe injuries that occur. So you have to make sure that, like I said, you have those controls in place. It's about trying to be as proactive as we can with the information that we do have from Ontario, from Alberta, from BC, the federal government as well. So like I said, some of the issues that may come up, work stoppage, you absolutely have to listen to that. I know, like I said, it's very, very tough, but just make sure that you work very closely with them. As soon as you can put their directions in place, you should be able to reopen. Just a key thing to remember is that they will most likely re-inspect the workplace prior to it reopening. So it's not just like they would tell you your orders and be on your way. They would ask you to, they would probably ask to take a look through your workplace before coming back in. And like I said, in the unfortunate event, there could be fines subjected to that as well. And that just depends on the severity of events, right? In my dealings with inspectors, whether it be Transport Canada, Ministry of Labor inspector, I find that it varies from inspector and the relationship that you have with them. It's very important to always be respectful with them. It's very important to be transparent with them and be willing to work with them. They are there to protect the employees, right? So they want to make sure that they have a feeling that, you have, if it's something that may be admitted, it may not be a work stoppage at all. It may not be a fine at all. They could simply tell you, you need to put up social distancing posters because it's not clear enough. It's really an objective look into your workplace to try to help you make it as safe as possible. So I know they got a little bit of a scary rep sometimes, but they are here to help you. They're here to work with you. Just make sure that you keep that open relationship. The worst thing that you could do is that a work stoppage could happen. They could ask to close your business and you keep it open. That would be absolutely detrimental to your business not to do that. I would highly not recommend that. And if you do need assistance with that, obviously, we are here to help you. We do have dedicated health and safety and HR advisors available on call most time during the day as well as at night currently, just due to the COVID-19 pandemic, to assist you. If you do receive a visit from the MOL, you can absolutely give us a call and we can walk you through that as well. MOL does get involved too when we are talking about work refusals. So if an employee is work refusing, as we had mentioned before, and you and your employee cannot resolve that work refusal at level 1, you're going to bring in your health and safety representative at level 2. And if it's still not resolved at that point, then the Ministry of Labor has to be contacted to do an investigation. So it's not just through inspections, it could actually be through a work refusal that they do show up. And that's why I stress the importance of making sure that you have your workplace ready for COVID-19. So if this does happen, and we can't avoid a work refusal, that you have the proper procedures in place. You have the signage, you have the building plan measures up, you have the communication out to your employees, so everyone is comfortable. And in instances as well, what I would highly recommend is that if there are opportunities where your employees can work from home, it is recommended that, you look at the potential of teleworking, because there will be some staff in your workplaces that are deemed high risk. And when I'm talking about high risk, I'm talking about anyone who has an underlying medical condition, anyone who is over the age of 65, anyone who has a compromised immune system. These are the individuals we need to make sure that we are accommodating if it is required, because under the Canadian Human Rights Commission, we do absolutely have the duty to accommodate to the point of undue hardship. So that's another important consideration that you want to take into account if you do have any workers that do approach you and feel that they are are within the high risk category. And there is a procedure for that as well. It mostly falls more so on the HR aspect, but that includes not just having them say that they are at risk. You want to make sure that you have the medical restriction form, which is called a functional abilities form, that will allow you to properly accommodate that person in their workplace. And the accommodation may be, teleworking if you do have the ability to provide that to your staff member. Could be working on reduced hours. It could be working, an alternate duty. These are things that you want to consider when you are looking at reopening. So, I know we spoke about quite a few things today with regards to COVID-19 and health and safety and preparing your workplace. Going to take the time to see if there's any other questions that are coming through before we wrap up. We will wrap up at around 1 o'clock today. So if any of you have questions that are coming through, please take the last couple minutes to send that through, and I will attempt to answer it before our time ends today. If you do have questions that you maybe think about after the live session today, I would most welcome you reaching out to myself or Peninsula, and we would be more than happy to accommodate you and walk you through some key advice with respects to health and safety, as well as any HR issues that you may foresee coming up. Whether it's talking about the new sick day proposal that has been coming through the media vines, layoffs, recalls, please let us know. We're absolutely here to help you. So I do not see any other questions coming through. So with that being said, I would sincerely love to take the time to thank all of you for joining today. It's been a pleasure speaking with you. It's been a pleasure assisting you. If you have any questions, please don't hesitate to reach out. Other than that, I hope you have a fantastic, safe day, and I will hopefully talk to some of you soon. Thank you, everyone. Have a great day.